So previously you saw how to do a pellet insertion on a male. Today we're going to demonstrate a proper technique for pellet insertion on a female. Just to rehash some of the pearls, some of you may have had experience with other areas for pellet insertion, which we'll talk about as we go forward. I'll explain why I tend to not like other areas beyond the upper outer glute area on a female. But we'll also talk about the anatomical areas where you're going to be mapping out so that you can have a painless insertion so that your patients keep coming back over and over again. Similar to a male insertion, you're going to have many of the same parts. You're going to have your disposable or stainless steel trocar, gloves, either sterile or non-sterile, alcohol pad, betadine or Hibiclins if you like to use that, some steri strips, and maybe even some mastisol to help either steri strips to stick to the skin and any bandages that you put just for compression after treatment. Most of these things will be in the disposable trocar kits if that's what you use. If you're starting out, I do like those simply because it has pretty much everything you need to get going in those kits. You don't have to buy a whole bunch of extra stuff. So we'll go ahead and get going. So first, if your patient is wearing any type of belt or buttons or anything like that, you'll have them undo those, the belt or buttons. And then for a female, you're just gonna want to expose the upper outer butt cheek area using a chuck or the pads that come in the trocar kit for modesty for the patient. So we'll go ahead and lift the shirt up just a little bit. Our lovely patient here is already undone and kind of partially unzipped. So we just need here to expose the upper outer glute area, the upper outer butt cheek, to not get too technical for this patient. Now, some of you may already have experience doing pellet insertions, and many of y'all may do pellet insertions potentially on the outer hip area, or I've even seen and heard of pellet insertions being done on the lower abdominal area. I don't like these for a couple reasons. One, especially if you have a younger patient or a patient that works out quite a bit, they may have still have quite a bit of glute muscle there, and so that can be very painful. You may actually poke muscle, which can lead to increased bruising and bleeding and post-procedure pain. And so the goal of this is that the patient feels as little as possible, and so they keep coming back over and over. Because that's really our goal here, is we want you to have patient retention of well over 90%. So that way you build a healthy pellet practice, okay? So as far as from an anatomical standpoint, on a female, I like the iliac crest, so pretty much the top of the hip here. We have the paraspinal area, and really what you're feeling for is the suprailiac fat pad. It's a very soft, almost pillowy tissue right in the upper outer butt cheek area. Think about if you were going to give somebody a shot, like a steroid shot or an antibiotic shot. Generally, this is kind of that area that you will be going to because there's not a lot of vascular beds, there's not a lot of nerve bundles there, so there's very little damage that you can do there as long as you are careful and just take good care of your patient. So from a marking standpoint, you can use just a regular ballpoint pen. You can use a skin marker if you so choose. I just tend to have a ballpoint pen because I carry them on me all the time. And so the first thing I'll mark is where the incision site I would like it to be. So with your male and female patients, generally you're gonna see either a pant line or an underwear line where they tend to like their pants or underwear to sit. Depending on how low or high this is, I will make the mark either just above or just below. On this particular patient, she likes to wear her pants just on the hips, not on the waist. And so based here, and really where I'm wanting to end up is over in this area here, I'm really going to err more toward the side of kind of right above the underwear or pant line for this patient. Then our hands are gonna follow what our eyes see. So we wanna make a second mark where we would like the tip of the trocar to end up. And it doesn't have to be exact, but it needs to be kind of in that line of where you'd like to go. So for her, I want to end up in this area right about here in that suprailiac fat pad. So pretty much a straight line, almost right along my pen this way, just kind of like that. So I will make a mark somewhere along that path, okay? Now for the demonstration purposes, also remind you that this is a clean procedure. It's not sterile. Now you are using sterile equipment, so you want to maintain the tips of the trocar that are going to go into your patient to be sterile. But as you get experience and your comfort level goes up, you can use regular procedure gloves if you like. For today, I'm going to go very strict as far as sterile procedure. I'm going to use both alcohol and some betadine to clean the skin. But again, this is not typically necessary as this is a clean procedure. Just straight alcohol, alcohol prep pads are typically all you need to clean the skin prior to making any incisions. Okay, so we're going to move on. So first we're going to clean the skin. I have the regular alcohol pad right here. We're just going to set this right over my mark. Be careful not to wipe too much because you're going to wipe off any ink if you used a skin marker or a ballpoint pen. Again, we're just going to kind of clean the area here. And then the disposable kits also come with a prep stick. This is chlorhexidine, not betadine. Most of them typically come with chlorhexidine just to prevent inflammation of the skin because a lot of patients can be sensitive to those iodines. So you just open that up, then you can use the chlorhexidine stick. Again, just little dabs. Don't rub too much around the mark because otherwise you're just going to remove that mark. So you can still visibly see that mark there. So nice and clean. Now we're going to numb up the patient. What I have here is a single 10 cc syringe with 1% lidocaine with epinephrine. It's got 8 cc's of that and 2 cc's of sodium bicarb. You can use 1 cc, you can use straight lidocaine with epi if you like. You can use lidocaine without epi if you like. I like the lidocaine with epi, one longer action, but also the epinephrine helps with bruising, causes some mild vasoconstriction, which again has longer action, but also prevents bleeding and bruising for the patient, which is overall just a much better result. But again, you can use lidocaine without if you like, or if the patient is sensitive to it as well, which can happen. So first, the first needle I use is a 1/2 inch 30 gauge needle. I like this because it's small and the patient typically doesn't feel the initial poke. I use this to numb up the skin. So first what we'll do is we have our mark. You can see it right here. I haven't completely wiped it off. And what we're going to do is we're going to make a small little poke. So 1, 2, 3 and a little pinch. And we're going to get a nice little wheel. So kind of like doing a TB skin test. We'll get a nice wheel where we intend to make that incision. And then we're going to come up to the skin level and go straight down. And we're going to inject about another 1/2 cc or so into the tissue there, because that's where our incision is going to be. So I want to make sure not just the skin, but that deeper tissue is nice and numbed up. And then we're going to switch. You can either switch to the 22 gauge needle that comes in the kit. It's a 22 gauge, 1.5 inch. I prefer a 1.5 inch 25 gauge needle, so usually a blue hub, for a couple reasons. One, it's a smaller gauge, so you have better control of the flow of the numbing medicine. And it's not so thin that it's at high risk of bending. So a 27 gauge, 1.5 inch, if you don't come all the way to the skin when you change angles, that can bend, and we don't want that. We definitely don't want any needle to potentially, break off or anything like that. So I tend to like a 25 gauge, 1.5 inch. So now what we're gonna do is we're gonna take this with the rest of our numbing, and we're gonna go right where we initially numbed up, a little pressure. And from here, we're going to angle the needle at a 30 to 45 degree angle in comparison to the patient's tissue. So not the table, but the patient's tissue. Our patient right here, hopefully you can appreciate on the video, has a nice curve to the hip and the glute area. So we want to be aware of that. If a patient tended to have a flatter glute area, whether from an older patient or genetically, we want to keep that in mind as we angle the needle. So we want the needle to be a 30 to 45 degree angle comparing to her tissue. So what we're going to do is we're going to go into the skin, making sure she doesn't feel anything, and we're going to start to numb up. So just nice and gentle pressure here. Now, there's a big pearl here, so I want you to pay attention. The tip of the needle is shorter than the sharp part of the trocars, regardless of what kind of trocar you're using. So you want to make sure that at this point, after you put in a little bit of numbing, that you push gently into the tissue about another 1/4 to 1/2 inch and inject. So as you can see, I'm injecting as I'm coming in and out of the tissue, kind of fanning it out nice and gentle. but I'm going to come to where the hub touches the skin. You can see it dimpling the skin, and I'm going to gently push another 1/4 to 1/2 inch or so, nice and gentle. You don't have to get aggressive with it. So that way we make sure that the patient doesn't feel that very last bit, because if you forget to do that, everything is going to go great until that very last 1/2 inch of putting that trocar in, and then your patient may not like you very much at that point, and you may have to go back and re-numb up those areas. So single 10 cc syringe is generally what you're going to need for a female. As we talked about in the male video, you may need a couple tracks to be able to get all of the pellets in for a male, because they may get 5, 6, sometimes even up to 10 testosterone pellets. So sometimes more than one track is necessary. As of yet, I have yet to need more than one track on any female for doing their complete pellet insertion, which is nice. And the other thing you'll see shortly as well is the trocar for females is visibly smaller than the male. Okay, so we're going to move on. So we've now numbed up our lovely patient. We're going to put on our gloves. Again, these are sterile nitrile gloves, so we're going to maintain sterility of the gloves here. But again, you can use just regular procedure gloves if you like. You do not have to use sterile gloves if you don't want. But these are sterile nitrile gloves. They're not the best fitting in the world, but they serve our purpose. Okay. So again, we have our sterile field over here, nice and clean and sterile. Now, if you have an assistant at this point, either you've already had your pellets opened or they're opening them now. This is nice because it gives everything a chance to numb up so the patient still likes you when you're done. We're making sure that we're not getting any significant bleeding, and we're not, and so we can proceed. Our lovely patient here is getting a couple of different pellets. You may be able to appreciate this on the camera here. She's getting both testosterone of 80 milligrams. She's getting estradiol and also getting progesterone. So she's getting all 3 of the hormones. This is in combination that has been most effective for her. And so that's what we're going to be doing. What I'd like for you to note here is the size of these pellets. You'll see that you have one that's kind of short, and then one that's kind of medium, like Mama Bear, and then you have a longer, thin one, which is the testosterone. I will explain why this is important as we actually do the pellet insertion, but keep in mind that some of these pellets are a different size. And so that's something to keep in mind as you move to actually inserting the pellets. All right, so now what we're gonna do, any disposable kit comes with a disposable 11 blade. I like the 11 blade because it's nice and effective for this procedure, and it doesn't leave a big scar. So again, our patient's clean. We're maintaining sterility and keeping the patient clean. At this point, she shouldn't feel anything. So just some pressure here. We're just gonna go straight down, perpendicular to the tissue directly where we numbed her up. That's all it takes. So just one stab incision. You can kind of work the tissue around a little bit just to break up any of the tissue kind of just right below the skin. And once you make your incision, you just want to make sure that you're keeping pressure on the incision site, so that way if the patient does ooze a little bit, it's not excessive. Some of the numbing medicines coming out the incision site just a little bit. So just a little pressure there. Good. The sharp obturator of the trocar comes with a little covering on it, so we're going to remove that covering. Again, keeping hands off of the tip of the trocar, keeping everything nice and clean. And then the sharp part will go inside. These ones do not lock, so you want to make sure that you take your hand and you brace the ends of these trocars in your hand so that they don't bounce back at you as you put the trocar into the patient to perform the pellet implant procedure. Good. So all we do is we take this little tip of the trocar, separate the skin just a little bit until the metal is below, right at the edge of the skin. At this point, we can gently just grab the tissue and bring it towards us, a little pressure straight down. Good. You'll feel the trocar just gently give right below the skin. Now at this point, you're going to remember that 30 to 45 degrees, and we're going to pull back on the tissue just gently, a little reverse traction. Again, keeping your hand or thumb on the end of the sharp obturator to prevent it from bouncing back. A little bit of reverse traction, 30 to 45 degrees. And then we're going to gently insert the trocar, checking about every inch or so making sure that we're at a good angle. You can see I can let go. We can see kind of the angle of trajectory here. Gentle traction. Perfect. And we notice, again, we're not going super deep. When I let go, the angle of this trocar isn't super steep. It's also not super shallow, just parallel with her skin. This is perfect. A little extra gentle traction here. Perfect. Now with these ones are pretty long, so you don't necessarily have to completely hub the trocar to be able to implant the pellets properly. At this point, we want to feel on the tissue to make sure we cannot feel the trocar at all. We shouldn't be able to feel it at all. You'll feel a little mound right here at the top where the numbing medicine is and where the trocar has displaced some of that tissue up, but you should not be able to feel the tip of the trocar at all. At this point, we can remove the sharp obturator, putting it back in a tray to keep it clean. You'll grab your pickups. If you have your own in a sterile deal, great. Again, the kit comes with disposable plastic pickups. These are slippery, so don't grip the pellets too strongly, otherwise you may get them flying across the room. Ask me how I know. So be very careful, just nice and gentle picking up these. So again, keep in mind that we have different sizes here. The estradiol will generally be smaller than the progesterone, which will be smaller than the testosterone. Well, the way I recommend putting the pellets in is from smallest to largest. If you put from largest to smallest, you could potentially crush a pellet in between. And if that happens, those pellets will immediately expand inside of the trocar and you pretty much have to start over. Another pearl would be that always put the hormones in the same order. So I again go from smallest to largest. So that means for a female, I go estrogen or estradiol or biest, progesterone, and then testosterone. That way I know what I'm giving the patient in what order at all times. So that way if something does happen, if you drop one, whatever, or one gets crushed, you know which one it was and you can simply replace that rather than having to start completely over. Again, ask me how I know. I don't want you to learn the way I had to learn, so that's why we're here. So now we're gonna load this. You load this like a torpedo tube. So we want the opening of the trocar to be facing directly up. You will use the cup underneath to catch anything. And we will load the estradiol first. It should just slide right in. Now, once you've started loading these pellets, you don't need to rush, but understand that as soon as these pellets touch any body fluid, they will start to expand and become somewhat soft. So you have about 30 to 45 seconds once you start loading this trocar to actually deploy the pellets. So now we're loaded. We'll put some pressure forward so that way when we deploy the blunt obturator here, the trocar doesn't kick back on us. So forward pressure, not hard, just gentle, and then we'll depress the plunger. You'll feel a click or hear a click. Make sure you depress all the way in. We'll feel for the pellets, make sure we can't feel them, which we can't. And at this point, we are done with this procedure. All the pellets are in the patient. She's doing great. A little bit of reverse traction here, or traction on the tissue as you pull the entire trocar in one fell swoop out with pressure over the incision site. At this point again, you check on your patient, make sure they're doing well. If you're using lidocaine with epi, you may actually see that the skin is blanched, which is a good sign that it's doing its job great. And at this point, we'll just make sure that any oozing or bleeding is well controlled. We'll work the tissue back together. And then at this point, we're just going to finish up cleaning with a little bit of alcohol. Avoiding alcohol around the incision site because that will sting. Good. Perfect. And then from here, your kit will also come with some steri strips, which can be used as long as the patient's not sensitive to adhesives to bring the skin close together. This will reduce scarring. If you're still wearing gloves, you can take them off at this time. Sometimes these things like to stick. If you like to use Mastisol, if you're going to use that after you've cleaned the skin, just make sure you use a little gauze to cover the incision site and then do the spray around the skin where these steri strips will go. We'll just come right across the incision site here. Again, being careful not to put too much traction on the skin. So there's one. I like to use two just to not put too much traction on the skin. At this point, I'm going to take my gloves off. clean gauze, just kind of as a little pressure dressing. The kits do come with a small tegaderm. Just as you get busier doing these, I do recommend investing in some larger tegaderm. The patients like them more. It doesn't feel like the gauze mounds up as much when you use a larger tegaderm. There's even some that have a pad actually right here in the middle, which is also nice for any absorption of numbing medicine, that type of thing. So I'll put the little gauze right over that incision site, a little pressure, tegaderm nice and flush to the skin, smoothing out any wrinkles or anything like that. Make sure to take all the paper part off, that way that doesn't poke them later. And there we have it, there we're done. So how'd you do? Feel anything?
Great.
Beautiful. At this point, we just, again, maintain modesty, clean up, keep the patient nice and covered as they get themselves all going and ready to go. And then you'll follow up with them according to your in-office protocols. You can have an office member follow up with them next day or two, make sure they're not too sore, and then go from there. I hope you found this video very helpful. If y'all have any questions at all, please do not hesitate to reach out to any of the Pro-Pell team. We're here to help y'all implement a profitable and pain-free practice as best as we can. Thank y'all very much.